Welcome to all of you in the audience. I'm Gianluca Fontana, and I am the Deputy Director of the Institute of Global Health Innovation, or IGHI. Thank you very much for your interest and for joining us today. I will wait just 1 second for people to have the time to join, and then I will get started with an overview of the agenda. So just a few seconds of wait before we start formally. Okay, so we are extremely proud today to launch our report, The Children's Palliative Care Provider of the Future, a blueprint to spark, scale, and share innovation. The report is the culmination of years of work by our team at IGHI, and particularly of our Helix Center for Design in Healthcare. I want to thank Ivor Williams for leading our work in children palliative care over the years, John T. Rowland, who's the main author and the driving force behind this report, and Maddie Lambert and Alex Shaw, who contributed to the writing and research. I would also like to show my appreciation to the over 50 experts that took part in the interviews that informed the report. This program of work at IGHI is only possible thanks to the generous support and really true partnership with the Fondazione Isabella Seragnoli and the Mais Family Office, and particularly thanks to Isabella Seragnoli, Maurizio Petta, Deborah Bolognesi, and Alberto Bortolotti. You will soon hear from John T. Rowland, who will share the key insights from the report. Following that, we will ask for your opinion and engagement, and we will discuss the topic of innovation in children's palliative care with an exceptional panel. And if we can move the slides over to the panel, this is the agenda which I'm talking through. So on the panel, you will have Julia Downing, who's the Chief Executive of the International Children's Palliative Care Network and one of the foremost experts on children's palliative care. Lina Chandra, who's the founder of Rachel House, a pioneer in children's hospice in Indonesia, who is 16 years today, the hospice. Ivor Williams, who I mentioned, Senior Design Associate at Helix Center and the lead for our work. And Gabriella Lake Walker, who is a policy advisor, an independent researcher, and also a speaker on children with complex needs. Finally, we will hear from Laura Dale Harris, the founding director of the Global Treehouse Foundation, who is a cherished partner of our work and that will try to share with us a call to action and some information on how the foundation plans to take forward the goals and recommendations on the report. So welcome to all of you again, and I'll pass over to John T. for his talk.
Great, thank you, Gianluca. And I am so pleased to be able to finally launch this report, which has been a long time in the making and which many of you in the room today contributed to producing, and which all of you, I hope, will find a useful tool to inject new energy and some new directions into your work. I want to add my thanks to IGHI and to the Mais Family Office and the Isabella Seragnoli Foundation for their foresight in commissioning this piece of work, as well as Julia Downing at the ICPCN for her expert hand-holding throughout. IGHI at Imperial, for those of you who don't know it, has always existed on the boundary of research and practice, And so while this report comes in the guise as a piece of observational policy research based on interviews with 50 children's palliative care leaders across 27 countries, its other purpose is as a celebration of the innovations in children's palliative care around the world, and a call to action to create new avenues and to spread and to scale these ideas. My background is not in children's palliative care, though I've always been a supporter of it. Outside of my research work, my bread and butter is designing and implementing systems of universal health coverage for governments. So I've built new national health insurance schemes in 6 countries and helped about 20 others to reform how they work. So while the real expertise around children's palliative care came from our interviewees in this project, I do know a fair bit about access to healthcare. And indeed, the impetus for doing what I do in my career came from the experience of losing my older brother to cancer as a young man when he was just a few months away from qualifying as a doctor. Now, we were fortunate as a family to experience what, even as a student, I understood to be pretty world-class palliative care. But I knew that even in my own country, the service we received was not the norm, let alone in far less well-resourced settings. And so almost 2 decades later, and having worked in more than 30 countries, I look around and as you can see on the next slide, I don't think there's been any sector in healthcare where I see such a gap persisting between need and access, that even with the universal health coverage movement that I've spent my career in, bringing coverage to millions of people around the world, more often than not, children's palliative care is not a big part of these reforms, at least not in its full expression. And so we see that today, as many of you will know, something like 21 million children around the world live with life-limiting conditions, of which 8 million require palliative care, and of whom 90% will never receive it. And as much as 65% of countries have no known dedicated pediatric palliative care services. And even in many wealthy countries, children's palliative care is either a patchwork of small charitably funded providers or small teams within much larger hospital operations. You cannot have universal health coverage without children's palliative care. And while there's a huge amount of work going on to get the sector the recognition and the funding it needs to educate decision makers and health professionals about it, we at IGHI saw an opportunity to ask the question, well, what role could innovation in how children's palliative care is delivered play to bridge these gaps in access? So we asked the question, what does innovation in children's palliative care currently look like? And what are the most promising opportunities for the future? And our interests were principally in service delivery, not in clinical or medical advances like new drugs and procedures. And as Gianluca said, the Isabella Seragnoli Foundation, which actually currently has its own children's hospice under construction in Italy, has been working and partnering with IGHI for some years on different innovations around how children's palliative care is delivered. And so they commissioned IGHI to write a policy paper that would start a conversation that I guess we're starting today about the state of innovation in children's palliative care, what the innovative providers of the future could look like, and how we could collectively as a community bring that optimistic vision to being. So that's what the report that's out today is about. And I would say that perhaps the biggest message for me was the sheer volume of innovative practice that we found happening at the front lines of care through users and families and staff, often out of necessity, working out clever ways to solve their immediate problems, whether that was in care coordination or communication or the care environment. Families are terrific problem solvers, as are the professionals that surround them. And we found so many examples of the two innovating constantly to meet their needs on a day-to-day basis. So many of our interviews went to double their length because of when we asked the question about what things were happening of the providers, we got so many responses. And so The first conclusion that I think shines out of this report is that although children's palliative care may not be the best resourced or the best research clinical area, many of its providers have a huge amount to teach the rest of the health system, particularly around areas, for example, about demedicalizing the care environment, or some of the ways we found that staff are managed to try different things and to have professional freedom, or around instances we found of making that ethos of person-centered care a reality rather than a sort of policy slogan. So none of these things are, flying cars and nanobots and those sorts of innovations. But as the reports that IGHI has produced on healthcare innovation have consistently shown over the years, the real root of innovation in healthcare is not technological tools, but a mentality and a methodology of starting with the lived experience of families and staff and patients and users, and teasing out the needs and the assets and the deficits from their perspective. The second headline finding is that despite all of that innovation that we found at the front line, there isn't really much support for those ideas to be shared or scaled up or spread around, which means that good innovations in one team or provider more often than not stay there and don't get invested in or expanded. So while the frugal or the sort of frontline nature of many of the innovations we found was a real strength, there are quite a few areas where we think technical expertise from outside of the sector and some investment could help to turn an innovation that's working locally into something that's ready for global adoption. So our hypothesis, I guess, to the reader, to you today, is that there's a real potential for a sprinkling of inputs from non-children's palliative care organisations to have a big impact in supporting providers to innovate. And that might be software or data analytics companies, it might be financiers or people working in gaming and entertainment or medtech, all types of organisations that, frankly, at the moment don't spend any of their time thinking about children's palliative care. But if offered a well-scoped opportunity to contribute to something and make a difference that would be adopted by 10 or 15 or 50 children's palliative care providers, might be very interested. And as you can see on the slide in front of you, we collated the examples that we got of current and future innovations into a framework of 9 areas or categories of high potential innovation, each of which we gave a kind of summary statement, which you'll find in the report. And those statements aren't prescriptions, they're provocations. They're not meant to say that we now understand everything of what future palliative care providers are going to look like or should look like. They're meant to give inspiration to you, to spark new thinking about what innovation might mean for you. What are the opportunities that you would most like to pursue and invest in? And each one of these areas is also accompanied by 2 or 3 case studies of somewhere where we found it was happening now. So to very briefly run through each one, we talk about a vision that is co-designed on the part with children and families for each providers. And we talk about different mechanisms for user participation in setting and executing a provider's vision. And given the majority of need in children's palliative care goes unmet, we also sort of challenge providers to think about ways to also gather perspectives of people who would benefit from their services but currently don't or can't. We talk about technology and all manner of applications of different areas where technology is and could play a part, from parent education, psychosocial support, play, data-driven care. And while we have some cases of new technologies in use, like 3D printing and augmented reality, as with the rest of healthcare, there's most of the opportunities come from, let's call it, implementation of and embedding old technologies, like the one I'm holding here. The place dimension is about the physical setting of children's palliative care, many of which we found, some real exemplars in design thinking to demedicalize the experience of receiving care. And in many contexts, we also talk about the trend that you'll know of buildings going from treatment centres to centres of excellence for training and service improvement. Under services, we talk about providers that increasingly steward and help to integrate the full spectrum of local children's palliative care services. So not just being concerned with their own direct service provision, but seeing part of their role as to have porous boundaries with other inpatient or outpatient or community services, so that patients and staff can easily move between them, with sort of choice as the main factor rather than organizational boundaries. And we talk about new organizational models and forms that are used to increase size and scale and footprint that providers can use, whether that's through joint ventures, joint appointments, provider networks and groups, and then using the economies of scale to reinvest in increased capabilities and quality. We talk about partnerships, which are an area that we already see children's palliative care providers being ahead of many of their healthcare counterparts, with some fantastic examples of using community assets to think creatively and to do more. And we talk about extending this further to an even more strategic network of partnerships that each provider would put in place to cover payers, providers, community, academia, and industry, they're leveraging those resources to do even more. By people, we mean the workforce, and we focus on continuing trends that providers shared around increasingly multidisciplinary teams and specialization of roles, and a recognition also of family members as perhaps the most important component of the children's palliative care workforce, which therefore deserves more formalized training and support to make the most of their time and skills. Under culture, we bring in the kind of wealth of research from IGHI colleagues over the years, and we talk about the practices and features of healthcare organizations generally that consistently create and adopt new innovations most effectively. And they do things like institutionalizing service user input, training their staff in design methodologies, and investing in targeted innovation expertise where that's helpful. And finally, under leadership, we talk about innovation not just applied to local service delivery, but in the ways that local providers get involved in advocacy and research and education. So as I said before, each of these 9 areas we pepper with case studies of where good practice is happening now, just a few of which you can see on the map there, and 3 of whom we have joining us on the panel. We have, as Gianluca said, Lina Chandra from Indonesia, whose Rachel House organization we feature in the services dimension to discuss her model of mobile nurse-led home care services in Indonesia, with staff given not just the technical skills they need, but business and finance training and responsibilities too, so that one day they can go off and form their own providers in their home provinces. Ivor Williams, who you've heard introduced, who works with our Helix Centre and who is featured in the culture section, following the use of design thinking methodology applied to 4 of the prototypes he's been working on. A connected garden, which turns plants into interactive objects that can react with sounds and light. An AI chatbot to help parents access information about their child's care. A digital platform to help parents and staff collectively record and store and curate memories about the child in real time, and an augmented reality baking game that uses a simple face and head movement interface and works off an iPhone. And finally, Julia from ICPCN, who are featured in our leadership dimension as an exemplar of advocating for the sector at a global level, but also helping to develop innovative approaches to education and helping to scale research into the measurement of outcomes into real world application. And as you can see, I hope from the spread there's a strong emphasis throughout our report that innovation is not the preserve of well-resourced health systems, but rather every country has something to teach and to learn from the rest of the world. Okay, so what now? As I said before, the report itself was written as a provocation to providers to consider where you want to focus your innovation, rather than a prescription from us about what you should be doing. But providers will need help. And so we do have recommendations for others, most importantly, for new partners to join in the mission of improving children's palliative care, bringing their expertise and resources. And we focus on organizations from the technology and the digital sectors, public institutions, private philanthropists, medical devices, and many more. And we think there are really tremendous opportunities to make a big social impact through their role and partnering with existing providers in the space on the untapped potential areas highlighted in the report. And this is not a passive sort of call into the wilderness like many recommendations you will see in policy reports. We intend to be active in making these partnerships happen, and you will hear more about that from Laura Dale Harris at the end of the webinar. So I will leave her to describe the what next. Until then, thank you for listening. I hope you will read and share the report widely. And now we want to hear from you as well as our panel. So I will hand back to Gianluca.
Thank you very much, Jonty. And I hope that after hearing about the report, you will really look at it in detail. The report will be accessible to the question that I've seen in the chat to everyone. And we really look forward to your feedback and thoughts, and hopefully you will use it in practice. So now, before we move on to our panel, is the time where I'll give you a second to connect on with our Mentimeter survey to hear your opinion and your thoughts about what you think should be the features of the children palliative care provider of the future. We will collect your thoughts now and while the panel speaks, and then I'll hand over back to Jonty to summarize some of the insights that are coming out. So you can scan the QR code to access the Mentimeter. Perhaps I'll ask our colleagues to put the link also in the chat so that you can quickly click on it, or you can go to menti.com and enter the code 41202821. So I will give a pause. I will have a pause now, let you access this link and give you a minute to start putting in your ideas. You can put in more than one entry. So as the panelists speak again, it will be great if you can add your thoughts. So I'll pause there for a second. Okay, I hope you've had a chance to write, and please do continue as well. So I would now want to welcome again our panel, and I will invite them all to turn on their cameras. So we have Julia Downing, who is the Chief Executive of ICPCN, Lina Chandra, Gabriella Lake-Walker, and Ivor Williams. A fantastic global and diverse panel that will talk to you today and try to answer some questions. So welcome to all of you, and thank you for taking part. The first question that I'm going to ask, and I'm going to start from you, Lina, is around of the areas of innovations that Jonty has shown here and that are included in the report. what do you think are the most important ones and the most relevant ones for the children's palliative care, and why? So Lina, over to you first. You'll have 3 or 4 minutes, and then we'll move on to the others as well. Thank you.
I wanted to highlight more of the question that Jonty raised of the inability for us to actually replicate the good ideas that we see in certain areas. And I think that's always been a big question, and even more so because of the pandemic. The pandemic has actually shown us the dire need for better care, especially in areas like Indonesia, where in the rural areas, people were completely without care. And so that's a question. And then the answer, the potential answer of using technology, collaboration, and making sure that we learn from one another. And I know the difficult part is culture. The difficult part also is not, something that works in the UK may not actually work in Indonesia. And so we need to have a better idea of bringing together the essence of what works, and then having people guide new services and people with courage to start services elsewhere and say what works best. That's one. 2, the porous boundaries. The boundaries of making sure that children can actually be passed along care systems or care institutions in a much better way. But that brings to question a better collaboration, better data sharing, and the ability of teams working together for the common cause, and bringing parents in and listening to parents and making sure that parents' needs are listened, are heard. And I think those porous boundaries, I wrote down shared data, making sure that community care is actually more highlighted in what we do going forward. And I think the pandemic has also shown the importance of community care. I'm going to stop there. So 2 things, question of replication, how can we learn better? And then how can we make the walls more porous so that patients can actually be transferred in a seamless manner?
Wonderful. Thank you very much, Lina. That's very, very insightful. And I'm sure the others will add and build on that. So thank you. And I'll come back to you later. But Ivor, now over to you for your thoughts.
Thanks, Gianluca. Yeah, I think for me, as a designer in this space, I think as maybe even Jonty mentioned, that these 2 elements of culture and technology, beyond the kind of the huge systemic issues, I think these are quite practical things that can be built and kind of cultivated. I would say culture is significant in the respect of how can we enable the teams, the healthcare teams, the families to do more effectively, and I really believe in the role of design to do that. We've just seen over the years across design in healthcare that what Helix has been doing for years, and then laterally doing that in children's hospice care, like the impact that we can make. And it's just really my dream, as it were, to spread that as far and wide as possible across all settings, across all cultures, to work with those different kind of cultures and those different settings, because I think beyond that, these are just different ways of looking at problems and trying to respond in creative ways. And I often think that designers can be, as it were, kind of useful antagonists, that we can be used as partners to gently prod and look at things a little bit differently, but always underpinned and grounded with the experience of the families and the professionals and the people who care for children in whatever setting, in whatever country. And I think in that respect, the role of technology has lots of different layers to it. I think there's a great Cedric Price, who's an architect, had the question: if technology is the answer, what is the question? I think thinking about what those questions really are allow us to kind of target the use of technology in either kind of large, grand, expansive ways, or in really super practical ways. And that kind of, I think, can then reflect the different settings that technology can be used. I'm thinking example, I think as Jonty mentioned, we had a play therapy prototype that we developed. And the response to that was, looking at the kind of the high cost, the kind of high volume, the large kind of use of technology for eye tracking software, and just kind of looking around and going, we can use off-the-shelf technology and shrink this down and make this far more accessible in terms of what is available for services to use and families to use. So that's kind of like it's like an everyday technology just retooled for the needs of children. And then there's the more kind of extensive, more grander kind of artificial intelligence things, which are kind of long-term things that we're all experiencing. I think there's lots and lots of opportunities there, and we can go into risks as well. But I think to say that those two things, for me personally, are very powerful ways of looking at it.
Thank you, Ivor. Thank you very much for that. And Gabriella, would love to hear your thoughts.
Thanks, Gianluca. Thanks everybody, and thanks for inviting me to be part of this panel and read the report. I thought it was really interesting and really fascinating read. In terms of the areas of innovation that I think were most interesting or useful, as it were, certainly from a kind of I suppose a user perspective, if that's the way to phrase it. There are a few things that I picked out, but actually the thread running through them was responsiveness. So I love the model with the nurses given their own budget lines and being taught in business management skills, because actually when it comes to meeting the needs of families, they're so wide ranging, and what you need and want and what your child needs is so individual, depending on so many, your circumstances, the condition, etc. It's that level of responsiveness, but also ownership and responsibility on behalf of the people that you're working with is really, really important. So often as a parent, you just feel so alone, and like everybody cares about their little bit of your child, but not the whole child and not the whole family. So having that ability of somebody and how empowering is that for a frontline worker as well, to actually have a budget line that they manage and that they can use with their families in the way that they and their families agree is the best thing. I think that's so important. And I really liked the example of Julia's house moving towards an unplanned form of respite and actually working with families to set in partnership to set what that offer might look like. And I noted there was the quote about actually most children with palliative care needs can be cared most of the time in primary care settings, but it's the systems and the staff who aren't confident or able to respond. So for me, it really is all about enabling responsiveness and enabling that partnership working, and really seeing families as part of the solution as well. And I think the other thing that came through really strongly is the issue of payers. And it's funny, Lina, I think you mentioned about what works in the UK might not work in Indonesia, but what I'm increasingly seeing is that what works in places like India really needs to be applied to the UK. So I feel like in the UK, we've become so boundaried with what is healthcare and what is social care and what is this, that, and the other, that it's really stifling innovation in this field, because actually what you need as a family is continuity. And ideally, what I would aspire to is that if you have a child with complex disability or diagnosed with a lifelong condition, your life doesn't actually change. You change, your emotions change, your circumstances to you personally change hugely, because how could it not? But what struck me the most, and what I absolutely was shocked by, was how my life, and how people's whole lives are affected in a way that they needn't be, and how disempowering that is, and how we can actually take very strong, capable families and make them very dependent on the state, which isn't giving them what they need. So that for me is crucial.
Thank you, Gabriella, for your thoughts and your really unique perspective on this. I'll come back with some follow-ups potentially later, but Julia, over to you to close the round on this, on the questions of the most important areas of innovation from the report in your view.
Thank you very much, Gianluca and Jonty, and it's been great as ICPCN to be working with you on this project and on this report. Looking at kind of the two most important areas, I think, like my colleagues, it's probably hard to pinpoint just two of them, but one of the threads I think that has been going through everybody's comments, but is that whole issue of listening to children and young people. And I think that's one of the innovations, if you like, that has been really gathering momentum in the last few years. We have many examples of where people who are setting up services, who are designing the services, are asking the children and young people and their families and their siblings. And I know you highlight that in the report, and I know some of my colleagues, Eva Masango, Lucy Coombs and the teams, we've all been talking to children, young children, ages 5 and upwards, around what they need and around their support. And I think that's a key innovation. In the past, people have said, well, you can't ask children that young, they won't know what to say, and that we know that they do. So I think that's a key innovation, and you raise that in several of the areas. You raise that in terms of vision, making sure that the vision is in line with what children and young people want. You raise that in the services, in the technology. So that is a key area for us. And I think one of the exciting things about this report is that it does highlight many of the innovations that are taking place, and as Jonty said earlier, that are happening around the world in children's palliative care. So I think another of the, we've heard about technology, and another of the key areas is that of partnerships and how we work together, and how we work not just with each other within the children's palliative care field, but that we work with the governments, how we work with different sectors, and again that's been highlighted in different areas of the report. So there are many key aspects, I think, of innovation here, and how we share with each other and how we learn from each other and how we partner with each other can help us to strengthen and to share and to utilize many of these innovations.
Thank you very much, Julia. And I will actually start from you with some follow-up questions. I'd love for you to actually comment from your experience on the feasibility of international collaboration and learning in the palliative care sector. We talked about some of the difficulties of sharing experiences across cultures, but obviously you've been running a global network of children's hospices that interact. And what are the areas and how do you see that international sharing and learning working best?
I think, as you say, obviously we think that's really important as the International Children's Palliative Care Network, so our members, organisations and individuals. And there is so much that we can learn from each other. I think one of our challenges has been that in many organisations we are so busy, and we have perhaps a few people that we're so busy providing the care, which is important and which is what we're focused on, that we don't necessarily have the time to or the resources to write up what we've been doing, or to undertake research to show the benefit of what we've been doing. And I think, through international collaborations, we can support each other to do that, with a international children's edition of eHospice, and we'll hopefully put up an article on that about this launch. But that is an area, and we're always keen to hear from people. So trying to enable people to share what they've been doing, to put people in touch with each other, and to help. I think it was Jonty you were saying as well, it's about how do we piece, or it might have been Lina, how do we bring out those things that are unique but that are shareable, that are usable? What are those key points that we can learn from each other, so that we're not reinventing the wheel, so that we're supporting each other as we set up new services, so that we're enabling more children and young people and their families to get access to palliative care. Of course, we have a challenge with language, and we don't necessarily all speak the first, our first language is not all the same, and so that is one of the challenges that we have felt over the years, and we're just beginning to overcome that with work in other languages as well. But I think it's really feasible, and I think, you know, certainly at ICPCN, that's one of our key roles and aims, is to help communicate and to help share and to help put people in touch and to help develop and strengthen that data, the evidence for children's palliative care.
Thank you, Julia. And Lina, I'd love to hear from you now, from someone that has obviously developed a hospice a few years ago now, but not that many. And I'd love to understand how this inspiration on the ways things are done and the way innovative things are done from other places, as if at all, influence the development of your hospice.
In the beginning, absolutely. Because it was a country where pediatric palliative care didn't exist. But in the beginning, replicating the model that I saw in Singapore, in Australia, in the UK, also meant that I made mistakes because I was going to start a building. And for the demographics of people we're set up to serve, a building would not solve their problem. Serving at home would actually solve the problem. So then I needed help in learning, what does home care look like? How do we make sure that patients can be referred from a national referral center to an outside care, which never happened before? So we needed to learn, how does referral look like and how can we actually share? So there are a lot of things that then it became a blended model. I took the hospice care, I learned from that. I learned from what referral system looked like, as what Gabriella was saying. We also needed to learn, how can we make sure that parents are not completely inundated, their lives couldn't get on, because our patients' parents basically had to work every day for their living. So how can we make sure that our service took care of that also? So I think learning that, we learned from Suresh Kumar in Kerala on the community care. So I needed to basically learn from everyone. Now, that presupposes that I have English, I could read, and that the language barrier didn't exist, and I could connect with people worldwide. And that's not always a given for people who are just starting out services.
Yeah.
So I think these are the things that, as I look back, and thank you for asking that question, Gianluca, because it's worthwhile for us to start highlighting what happens when people don't speak English, what happens when they don't have all these connections. How can we make that easier for them?
Yep. And it would be a very interesting follow-up to this conversation to think about, and we'll hear a bit from Laura about that, but about how we can support and help people that are going on that journey. So thank you very much for that note. A quick question to close off the panel to Gabriella. On the topic of technology, you know, we have reflected a lot, as we always do, on the opportunities and the risks of technology. Briefly, would love to hear from you, from the point of view of families, what are the hopes and concerns, if you will, about the role that technology can play in children's palliative care?
Thank you, Gianluca. So I actually, if my very honest answer is, I think it could be it can be very distracting. I think that it's really easy, especially in a really well-resourced healthcare system like we have in the UK, to look for the lazy beans and the shiny things and the new drugs and the technological answers to all of these problems. And again, I go back to, and it almost relates to the last question as well, about learning internationally. And I do think sometimes we need to actually step back and look at the basics. And you know, there are some fundamental aspects to being human that we all share across the globe. And I do think we need to consider those things first. I think technology can be a huge enabler. And I think that some of the things that have been described, certainly in terms of play therapies and and helping children to communicate. I think that's where we need to focus our attention. You know, there are so many different conditions that are life limiting for children, and many of them cause complex disability, and we won't have a cure for. And you can't, for every different genetic anomaly, we can't create a cure, but we can create quality of life. We can create the best quality of life. So if we can focus, and so therefore focus attention on, when it comes to technology, on helping the child to communicate, helping the child to get around. So people are saying bulky equipment and this, that, and the other can be a barrier to children going out and about. No, it doesn't need to be. It really doesn't need to be, with the right creativity. And I think we just need to have that front and center. If it was me, what would I want? You know, it doesn't matter if you can't communicate. It doesn't matter if you can't move. If you want to go swimming, you can go swimming. If you want to be involved in your community, you be involved in your community. There are some really fundamental things that I think we all share, and we really need to focus on.
Thank you, Gabriella. And you know, what you highlight really goes to the core of what perhaps academically we call user-centered design, but it's, you know, really starting from those needs and those desires. So thank you very much, and thank you to the whole panel for a very, very insightful discussion. As you can see, this is only the beginning. We've had a few minutes to have these conversations. There is so much to explore and so much help and support that can be provided within this community and this movement. So we really hope that we can take this forward beyond today. But thank you very much for now. And I will turn over to Jonty now for a bit of a summary of the insights that have come out from the comments from you, the audience.
Yeah, so well, thank you. So we got tons and tons. There were like 5 slides worth of all these different comments, which I have very rapidly attempted to group just to kind of hear of some sort of flavor from the room. And I sort of put them into the 3 sort of categories, I think. The first of which is comments around the bonds or the boundaries or the bridges or the networks between providers in this space. So people talking about a need for more international collaborations and partnerships, as you were discussing there. Something around sharing data between providers on different areas of the services they provide, and kind of standardizing between that so that useful comparisons can be made. Just different routes that are needed to be able to spread innovations and have these types of conversations. And then bridges with technology or digital players that can help to do some of this. I think there's another category around kind of how providers face the rest of the system or engage with the rest of the health system. So some interesting comments around, you know, the provider of the future being sort of more politically aware and astute. Service that you know, managing to secure sort of permanent and proper funding. Active in delivering, you know, and helping to create high quality research into the area, and leading the education, especially the education of, you know, staff who don't work for a particular pediatric palliative care provider. Also things around, you know, these services being integrated in with the rest of the health system rather than parallel, and supporting others to in the system to become providers of children's palliative care. And then a third category that I would say are around sort of the principles, the approaches, or sort of where do we want to get to, and there people talking about things like shared decision making, caregiver empowerment, and sort of flexible or more personalized or choice-based approaches, as Gabriella was talking about there. So that was just a flavor, quite a lot of things. We'll take all of these very, very gratefully into the future work we're doing in this area. So thank you.
Thank you, Jonty. And absolutely, we will take this forward, and we will take this forward also in collaboration with the next speaker that I will introduce shortly. And I just want to thank also the people that are commenting, and particularly Jonathan, which from the US, who has shared his experience. And you know, it's fantastic to have just from some of the names that I recognize among the audience participants, such a diverse group of real change makers in this field, connected, and definitely let's make this the start of something. So thank you, Jonty, for now. And I want to introduce Laura Del Harris, who will close with a call to action from the Global Treehouse Foundation, which is an organization that is a core partner for the work at Imperial College, but it's a standalone organization that is going to try to drive forward some of the next steps coming from the report. So very excited from here to hear from you, Laura, and over to you.
Thank you, Gianluca, and thank you all the panelists for this really exciting discussion. So I'll share a little bit of background on the goals of this initiative, but more importantly, how you can get involved. So if you can move on the slide, so that's very much what we're working towards. Just stepping back, is that more children get the support they need in order to live their lives to the fullest, no matter the health condition. And we know, and we've heard today, that increasing access to palliative care is key to that vision, whether that support is provided in the home, in the community, which is most of the time, as Lina reminded, or in the hospital or hospice setting. And we also heard that lots and lots of innovation is happening and that excellence is happening, but it's not sufficiently supported, shared, or sustained. And we know the report only picks out some examples. So our goals are, and you can see here, our goals are sort of is very much to respond to that, and to first start building a community of those new providers to address this gap in access, and also make it easier for existing providers to collaborate on joint projects and share that excellence. So that's very much on the why and the what. And I guess we know this is hard, and this requires convening individuals and organizations that aren't currently engaged in children palliative care. They might not know what palliative care is, or if they do, they might not know what to do about it, but they can help with their expertise, whether it's in campaigning, whether it's in marketing, or just financial resources. And we know that requires using data in a different way, digital and tech. For example, something we're really excited about is how to look for opportunities to put in practice the findings of the current research on outcome measures. And finally, something we heard lots today is this requires really, really listening to children and family, and perhaps more than any field of medicine, and something that Julia mentioned now and came through the research from the Helix Center. And I won't talk about it, but just to share some of the things we heard from children and family, if we can share the next slides, about the need and support they needed. So that's coming from the perspective of children. We heard of group of families, and then their siblings on the next slides, and then their parents. And obviously, I'm not even talking about staff and professionals working with them. So our first step is to bring together people around a few roundtables, laying the foundation for those joint projects, a bit like a light twinning collaboration, if that makes sense. And practically speaking, we're inviting you to join one or more of those roundtables over the next 6 to 9 months. And before I tell you more about those, there are 2 ways of signing up. You can just reply in the Zoom chat yes and say which one you're interested in, and we'll make a list, or you can reply to the email we'll be sharing after the event. So what are those roundtables? So thank you very much to the many of you I've spoken to who helped shape some of those themes. And this is just the beginning. So the first is, how do we collectively strengthen the case for further philanthropic and governmental support? So that's very much talking to the need to open new doors and increasing that supply. So we know that this required a fine balance between making it emotionally palatable for people to engage meaningfully without sugarcoating the reality. And practically, we've heard that this might require strengthening the case, the economic case for children palliative care, it might require evidence, the broader impact on communities beyond the children. Or it might be about using data to demonstrate change at a service level beyond individual level outcomes. So that's the first one. The second is about how can innovation support the development and scaling of new models for addressing psychosocial spiritual needs. And there's lots of rich learning from what Gabrielle talked about earlier in terms of the very practical support, what we can learn from places like support brokerage, life planning, but also what we can learn from places like Ukraine in terms of their response to palliative care, but also things like the recent improvements in tech for mental health. So lots and lots to do around this second roundtables. The third, which we talked about in the panel just now, is what are the most promising opportunities to improve places and equipment for children with life-limiting conditions. And they're very practical. There are many practical things that can be done. I've talked about some of them in terms of using existing tech. And so that's very much about improving places and equipment. And the fourth, which is really coming from the research as well, is what can other fields of healthcare and community care more broadly benefit from the skills and approach of children palliative care. So for instance, and it was mentioned in the panel just now, how can tech and simulation-based training help scale things like effective communication skills. So those are those 4 roundtables. Please sign up and feel free to join more broadly with people who couldn't join today. And we'll come back to you with the logistics around this. Thank you, everyone.
Thank you, Laura. And the important thing to take away here is that there's an organization and a friend here that wants to help, and with a clear mission, but with a still in a phase where we are figuring out how the foundation and the charity can help. So just bring your questions and your desires. And it's very, very important to note that we are pursuing this in close partnership and collaboration with ICPCN and with Julia. And there's limited resources in this sector. The Global Treehouse Foundation is there to add help and not obviously to crowd the space. And we work in very close collaboration with ICPCN, but equally if there are other organizations and networks that we think the charity should interact with, please share with Laura and with us. So on that note, I just want to thank everyone that has joined us today. First and foremost, the panel and the speakers, but all of you in the audience. I'll repeat myself, but I really hope that today is the start of something, and is or the continuation of a movement that is already there, and that this report and this charity can now support further. Thank you also, to conclude, to Misha Patel and Peter Howitt, who have made today possible and have really organized everything. So thanks to all of you. Really grateful for all your contributions, really grateful for all your comments in the Mentimeter and in the chat. You have the email of the charity as well. We hope to hear from you. And we'll hope that you can soon access the report and read it. Thank you.
Thanks, everyone. Goodbye.